Hello, hello, and thank you so much for tuning in to this episode of ClearedCast, which will be part one of a few-part series. So, our guest, Lauren Rich, knows what it's like firsthand to live with the aftermath of combat and help vets overcome that trauma because she's actually married to a combat vet and has worked as a combat trauma PTSD psychotherapist with the VA for 7 years. So, she also previously held a clearance and now has a private practice treating PTSD and combat veterans, many of whom have had classified traumas. So, today for this episode, we're going to talk about combat veterans kicking trauma's ass. First, I thought, Lauren, thank you so much for joining me, but I thought that we could talk about some
Sure.
therapy misconceptions that some of our security clearance holders may have.
I think one misconception is that they can't seek help because their trauma is classified. I have seen veterans who have had classified events or traumas since the early 80s. They were serving in Germany doing helicopter routine flyovers and things like that. And those things still remain classified for many of them. But that doesn't mean that you can't seek treatment. There are ways to do that. You just have to find a qualified, knowledgeable professional who can help you through that process. So I think that's the number one misconception. The second would probably be that for someone who has an active clearance, seeking treatment is a risk for losing said clearance. And I completely understand why. There is a lot of fear in that, especially when your clearance is what enables you to provide for your family, and it's partially your livelihood. Without it, you don't know what you would do, or you don't know who you could work for. You've maybe never done anything else, and so the fear of losing that is essentially the fear of losing income. If you can find that with a local provider, that is the route to go. So don't think that you have to see somebody just because they have a clearance. Just because your provider is in the employee assistance unit or just because your provider has a clearance doesn't mean that they're quality. So we need to find somebody who's quality and either has a clearance or can do the workaround.
Let's talk about that a little bit more because I'm sure that for some security clearance holders or even folks where, events, their trauma is surrounded by an event that was classified, it could deter them
Mhm.
from actually seeking out treatment that they so desperately need. So let's talk about EMDR a little bit further and why security clearance holders or those folks that have had trauma with classified events and maybe their security clearance has lapsed should be seeking out treatment and why EMDR is so great for that.
Sure. So the big three that are endorsed by the DoD and the Department of Veterans Affairs are called prolonged exposure, cognitive processing therapy, and EMDR or eye movement desensitization and reprocessing. And I am trained in all three of those, have used all of them for years. So prolonged exposure and cognitive processing therapy both take the approach that we work in your frontal lobe, meaning that we basically argue with trauma and we work to challenge your thoughts. But part of the struggle is that you have to come into a provider's office and you either have to um, verbally recount or you have to write in narrative form in great detail the variables of that event. And if you have a classified event, you just can't do that. It's not possible. If you can't include anything beyond continental, continental identifiers, then how are we ever supposed to get to, witnessing the violence against people in particular countries? So that one just, there is no logic in that. It doesn't make any sense to me how that would be possible. Uh, the EMDR option takes it from a nervous system approach. So, in other words, trauma is stored in our bodies, and therefore, even though we argue with it cognitively, it will not be resolved until we take care of our body first and then move to the cognition. In the first year that I was prolonged exposure certified, I probably put at least 30 veterans of multiple deployments through prolonged exposure. And I thought we were doing really well. And then the year mark hit, and all of them came back except one. And he only had one isolated trauma from 1991 that involved a ferry boat accident near Egypt. And we were able to resolve that. He had nightly nightmares, and we were able to resolve those. All of the others, though, who had deployed multiple times, who had been in law enforcement, who had worked for the State Department or whatever that may be, and had complex trauma or repeat traumas, came back and said, Doc, my symptoms are back. That one still bothers me, or that one no longer bothers me, but all of the others bother me. So at that point, I stopped utilizing it because it is so incredibly hard. People and I think clinicians maybe especially underestimate how hard treatment is for people. It is the one of the hardest things that you will ever do. Some people say it's harder than actually living through the event itself. And so, my promise most of the time to my veterans is if you can get here, I will get you through the rest. Just make it to my office and I will guide you through the rest of the process. But when you tack on other things like disclosing variables such as sight, sound, and smell, it gets exponentially harder. And so the I learned over time that the dropout rate for things like prolonged exposure is ridiculously high. It's somewhere in the 40% range. And so, would you ever take a cancer treatment that had a 40% dropout rate? I wouldn't. I would. There's no way I would do that. Yeah, yeah. Find me something better. So why would we expect people to do that in a psychological stance? I also think it very much puts people at ease when they know that they don't have to disclose.
So please drop us a comment if you have specific questions, and we'll be sure to address that in our next part of the series as well. So as always, for more information on mental health or your security clearance, you can visit news.clearancejobs.com.